Nearly 4 in 10 Americans past the age of 70 manage signs of peripheral neuropathy. That represents a very common concern affecting neighborhoods, households, or perhaps you personally. What makes this situation more serious is that data indicates over 60% of those experiencing these signals remain unadvised by their healthcare teams. It's not that your healthcare provider isn't concerned, rather, nerve damage in your lower limbs remains a highly neglected, frequently missed concern for seniors past 60. The actual consequence of leaving it unrecognized goes far beyond temporary irritation. It impacts your posture, your overall freedom of movement, and your capacity to move confidently. If you have been noticing numbness in your toes or legs, or ongoing warmth, buzzing, or an odd sense that your lower limbs aren't quite connected to you, make sure to watch carefully. In our session today, we will dissect exactly what's taking place inside your body and explore why this issue progresses each year if left unaddressed. Most importantly, we will highlight 7 practical, research validated physical exercises that you can try right away to support nerve healing. Stick around, as this topic is extremely vital. I'm Dr. William Lee, and throughout my years in medicine, I've continuously heard patients receive one of the most discouraging responses a clinician can give. This is simply a natural part of aging. I disagree, and my goal today is to challenge that claim. In this guide, we are focusing on 3 main concepts. First, we will examine the biological changes in your nervous pathways and identify why these concerns escalate past 60. Second, we'll reveal a major underlying trigger that is commonly ignored in general checkups, and it isn't what most would assume. Third, I will guide you through 7 targeted, scientifically supported physical movements designed to manage this issue. These aren't just general activities, they are organized exercises with direct therapeutic purposes. I'm going to walk you through exactly why every individual movement supports your recovery. Toward our conclusion, we will look over an important perspective that is rarely discussed during quick office consultations, a piece of data developed over years that could reshape your management plan. Let's begin. Let me invite you to visualize a typical scenario. You open your eyes in the morning, pivot to rest along the side of the mattress, and the very second your soles make contact with the floor tiles, you notice an unusual sensation. It might not feel like acute aching, but rather a sense of isolation, as if your toes were buried in layers of soft fabric, or the electrical impulses from your lower body to your head were traveling through a weak connection. You might already be familiar with this exact feeling, perhaps having observed it for consecutive months while silently wishing it would clear up on its own. This particular physical challenge is termed peripheral neuropathy, signaling that your lower nerve pathways, spanning from your spine down through your limbs, are encountering obstacles as they try to function properly. Usually, hearing the term neuropathy leads most individuals to immediately suspect diabetes. While glucose management issues are certainly a major factor, here is a detail that frequently surprises many people I consult with. Data indicates that about 25% of seniors over 70 live with some form of peripheral nerve issues, including many individuals with entirely normal metabolic panels. Take a moment to think about that fact. You do not require a diabetes diagnosis to develop these sensations. Advancing years are by themselves a primary variable, with risks scaling upward as time passes. What makes this progression occur? Put simply, your lower pathways are composed of active, living tissues that require an ongoing stream of rich oxygen and key nutrients supplied by microscopic blood capillaries, the smallest pathways in your circulatory loop, thinner than single hairs. As we mature, these microscopic passages naturally become narrower, slowing regular blood delivery and starving the surrounding nerves. Eventually, these undernourished structures begin signaling irregularly or shut down completely. This circulatory drop-off is exactly what generates local numbness and warm prickles. This brings us directly to the core underlying issue of this challenge, which rarely gets the attention it deserves. The real threat isn't diabetes, lack of simple vitamins, or simply the passing years. It centers around a silent vascular issue, microcirculatory collapse around the nerves. This refers to the gradual, continuous closing off of the tiny capillary structures meant to nurture your lower pathways. This silent vascular shutdown can occur inside individuals with completely balanced sugars, healthy cholesterol numbers, and general wellness panels simply because the microvascular system around your lower limbs is incredibly vulnerable. Standard evaluations rarely capture this quiet microcirculatory starvation. Typical screens tend to check specifically for high glucose, obvious bone abnormalities, or massive injury. Yet, because compromised nerve function serves as a confirmed independent catalyst for slips and stability issues among older individuals, addressing this under the radar microcirculation loss remains highly important. Let us explore how you can take action. Once the underlying vascular starving is clear, the target for recovery makes real practical sense. These 7 physical routines are crafted with 2 goals: promoting fresh circulatory volume toward those deprived neural cells and coordinating clear communication channels between your lower extremities and your brain. You can easily perform several of these patterns while seated. The majority demand less than 5 minutes of your time, and they are fully backed by established clinical investigations. Let's go over them step by step. The first movement on our list is the early morning ankle alphabet. Prior to placing your weight on the bedroom floor at the start of your day, spend a brief moment practicing this. Align yourself on the edge of the mattress, raise one foot slightly, and carefully draw the shapes of the alphabet in the air using your toe. Work through deliberate, full shapes from A through Z before repeating the process with your opposite limb. Why does this simple movement help? It isn't just an easy stretching routine. Every single letter shapes your ankle through several active planes of motion, working as a physical mechanical pump that pulls fresh blood directly into the fine capillaries running around the lower nerves. This helps irrigate pathways that went hours under diminished blood volume while you slept. Broad systematic studies in recognized clinical journals note that structured physical and mobility training meaningfully boosts your baseline levels of brain derived neurotrophic factor, also called BDNF, which acts as a main biological support for repair. Achieving this neurological stimulation does not require strenuous sports. Accessible, steady movement patterns around your lower legs are sufficient to trigger development. In short, these short morning minutes do much more than just encourage minor mobility. They prepare and defend your nerves from first step imbalance. Make it a regular daily routine. Second, we have the toe spread and towel grip, which we can call our local muscle activation routine. Settle into a firm chair and lay a small face towel flat on the ground. Utilizing bare soles, slowly draw the towel's fabric inward by clamping and pulling it backward using your toes. Execute 10 continuous pulls, and then spread your toes outward as far as your structures allow, maintaining the shape for 3 seconds before resting. Work through 3 full groupings for each foot. The reason this works, as we pass 60, many of us unintentionally decrease use of the delicate inner structural muscles within the feet themselves. When these localized support muscles stay inactive over long blocks, they diminish vital proprioceptive communication going back to the nervous system. This proprioception represents your brain's ability to map where you stand, heavily relying on fine structural signals from your soles. Studies checking the efficacy of movement routines confirm that targeted local feet conditioning directly improves extremity control and balance outcomes for those experiencing nerve sensitivity. Strengthening your toes serves as the foundational leverage point of your walk. Performing 3 groups of 10 repetitions can be easily accomplished while going through news streams, demanding virtually no tools. Third on our list is heel-to-toe weight shifts designed to gently encourage postural stability. Settle beside a steady flat counter and place fingers along its edge for easy safety margins. Slowly glide your full weight forward onto the front of your soles, staying there for 2 seconds, and then ease backward toward your heels for a matching 2-second block. Repeat this easy gliding transition 15 times. This serves a vital mechanical goal. Lower nerve structures are charged with communicating positioning to higher nervous networks alongside capturing temperature or pain sensations. Every weight displacement uses small sensors in your soles to transmit real-time alerts so your balance can stay centered. When nerve problems quiet down this continuous feedback, stability issues unfold due to disrupted sensory signals rather than from localized muscle wasting. Practicing shifts actively reestablishes these neurological avenues. Keep in mind that when trying to restore balance, many people make the mistake of focusing only on leg strength workouts. While keeping core legs solid plays a key role, the underlying challenge lies in compromised neural pathways. Rather than building massive muscle fiber, we are helping organize structural feedback patterns. Performing this regularly is about learning to read the quiet sensations arriving from your feet again, showing positive indicators as sensory connections resume. Fourth, we incorporate textured walking to stimulate underlying skin nerve paths. Try preparing a plush bath towel by folding it neatly to create a dense base, or source an embossed wellness mat. Devote 5 minutes walking gently along this textured pathway without footwear. As a progressive step down the line, working with flat surface stone layouts is incredibly supportive. What are the biomechanics at play? This process helps with tactile pathway training, as pathways require detailed structural experiences to remain highly integrated. When you spent most of your time walking over completely level surfaces like home tile or wood laminates, your soles missed out on complex sensory cues. Choosing diverse or contoured materials underfoot forces those nerves to coordinate with new signals, adapting and organizing response patterns. In clinical data, safe tactile stimulus has actually shown real links to the proliferation of delicate neural terminations within your skin. Extensive evaluations demonstrate that gentle cardiovascular work combined with structural touch inputs actively encourages the replication and outgrowth of minor epidermal nerve branches. These routines encourage targeted synthesis of nerve growth factor, or NGF, to support development. Placing clean soles directly on distinct tactile spaces for a few daily minutes serves as a simple but highly effective practice. The fifth daily drill is rising onto your toes to act as a vascular driver. Remaining close to a flat counter surface, raise up onto your midfoot, staying temporarily at your maximum height, and descend at a steady pace. Cycle through 2 groups of 15 repetitions. Let us outline the structural significance. The heavy muscles within your calf play an integral role as secondary pumps for backflow vascular pathways. Contracting these muscle bands mechanically squeezes used volume back upward through your limbs, helping clear excess fluids. Under persistent cellular tension, allowing unused fluid and typical metabolites to sit and pool near sensitive nerve clusters worsens nerve pain. Simple, raising movements help clean the lower areas out, much like compressing a damp sponge to encourage fresh water. Clinical data confirms that keeping active flow dynamics is a highly adaptable parameter in limiting structural progression, since encouraging vein returns cleans up local tissues and balances fluid areas. Integrate these slow, smooth toe rises near the end of your routine for the most reliable results. Exercise 6 utilizes a leg extension paired with a flexible foot pull to coordinate our lower pathway glide. Seat yourself securely in a solid kitchen chair, raise one limb straight ahead, and pull your foot backward towards your knee, keeping that alignment active for 5 seconds before pointing your toes straight away for an identical block. Return smoothly and repeat 10 times on each side. Why do we target this exact angle? It produces a gentle glide throughout the larger pathways, running along your sciatic and perineal pathways, traversing from your sacrum through to your toes. Gently loading these key roots helps mobilize minor blockages and promotes intraneural blood flow. Clinical fields categorize this simple protective stretching method as neural mobilization, using it widely inside post-recovery programs. Even if it is rarely discussed during general clinic checkups, nerve structures that experience compressed circulation show very helpful responses and improvements under smooth movement inputs, much like tendons or major muscles do, leading to healthier feedback signals over time. Make sure you proceed slowly. Aim for a light, mild sensation rather than straining. The seventh pattern on our list is slow standing, marching to reset sensory coordinates. Settle within arm's reach of your counter and slowly lift alternating knees to a comfortable height over a 2-minute window. Keep your transitions smooth and let your posture sit naturally, focusing fully on coordinated balance rather than heavy exertion. What takes place neurologically here? Consistent paced marching forces the brain to reconcile postural sensory demands along with the active mechanics of placing your foot, requiring precise cooperation from lower nerves through to core muscle regions. Each transition serves as a direct pathway exercise to help reconnect our coordinates. Investigations tracking this show that completing similar structured, non strenuous ankle and feet exercises for as little as 3 days a week yields measurable decreases in baseline pain, keeping those improvements fully active for months down the line. To maximize the benefit, round out each movement session with these slow marches to secure your postural mechanics, reinforce connections, and confirm with your nerve networks that you are moving successfully. Let me address an important aspect that our standard office visits rarely permit sufficient time to map out. Generally, individuals navigating these issues walk away with a medication choice or are booked for a several month wait with a specialist. What is rarely integrated is a constructive strategy using motion. In fact, many health metrics suffer underuse simply because shorter schedules don't routinely incorporate basic functional or movement checks. However, data continues to highlight that specific physical exercises can encourage local expression of nerve growth factor alongside BDNF, which our bodies actively use to restore and mend damaged neural branches. Consider this point. Actual proteins that encourage nerve tissue recovery can be naturally triggered by routine daily activity, not just pharmaceutical choices. Clinical documentation for physical stimulation of neuroplasticity and nerve healing in extremities has continued to build in professional journals over several decades. Shorter schedules naturally lean toward prescribing rather than providing step by step physical walkthroughs, which explains why this rarely makes it to consultations. It remains entirely within your capabilities to foster healing, as neuroplasticity and sensory adaptation function successfully past 60, with your systems ready to adapt and repair when given proper support. Let's synthesize these routines into a structured, easily integrated weekly template. Your first key rule is to perform the morning ankle alphabet prior to climbing out of bed. Spending 3 minutes moving through these shapes acts as an excellent foundational choice, delivering needed circulation back to smaller vascular capillary clusters prior to taking any steps, which will significantly reduce feelings of first step stiffness. Next, pair toe contractions, extensions, and weight transfers into a focused 10-minute window 3 times per week. This can easily be run during your typical home wait times with just a towel and kitchen top nearby. Stay mindful of sensory shifts during shifts. Even if sensations initially seem somewhat limited, dedicated focus encourages nerve pathway rehabilitation and real improvements down the line. Our third guideline integrates textured footsteps and rise exercises into your daily practices. Devoting several minutes on distinctive tactile materials alongside regular sets of toe lifts stimulates epidermal fiber branches while driving out excess metabolic swelling around neural channels. Lastly, coordinate straight extensions and slow steps thrice weekly to foster optimal neural system alignment, as dynamic moves directly target sciatica pathways while marching ties all sensory inputs successfully back together. I want to share some realistic goals to guide your journey. Neural tissues naturally require dedicated, patient windows of time to reform. You will generally observe positive progress around the 1 to 2 month mark of continuous adherence, usually beginning with shifts in coordination, followed by balanced sensitivity under your toes and lighter temperature extremes over time. For more developed nerve concerns, prepare to review these target methods with your clinical care physician. Ask for direct evaluations with focus on professional physical therapy resources. Check on methods to optimize cellular support factors like BDNF, and inquire how best to weave focused movement targets directly with other protocols. These checks are worth completing. Starting minor movements like drawing toe letters starting tomorrow early morning represents a significant stride toward regaining comfort and control. To summarize our discussion, you are now equipped to define actual nerve concerns, identify how microcapillary narrowing plays a core role, and note why busy timetables can omit useful mechanical solutions. Best of all, we have highlighted 7 practical, clinical-based drills built to help restore balanced physical environments. not by muting indicators, but by answering the calls for blood and motion behind ongoing numbness, heat, and structural balance needs. If these detailed medical strategies align with your priorities, consider selecting Subscribe below. We distribute highly informative health presentations every week, tailored specifically for staying fully fit after 60. Next time, we'll dive further into related concerns by exploring underlying issues causing coordination changes in later years, along with practical adjustments most systems bypass. I look forward to working together during our next update.